Healthcare and the planet is blessed with some pioneers, people who see farther and sooner than others do.
I started to feel this overwhelming sense of concern about the culture in healthcare, that really we have a crisis in how we all treat each other. I would have to say that everyone, me included, comes into healthcare with this aspiration that we're going to be able to help other people and do our absolute best. The system can sometimes beat that out of you, and what I would like to be able to do is bring back to people the humanity and the good sides of healthcare and the reason why they got into this in the very first place. I'm intrinsically very shy, and the idea of public speaking or ever putting my hand up to answer a question in medical school was anathema to me. Yet there was a tipping point, and that was when I started to be involved in doing procedures on young children with cancer. Their bone marrow and lumbar puncture procedures. The children would get extremely distressed, and I watched their distress increase as the weeks went by and they had more procedures. It was traumatic for the parents as well, and I found it traumatic. The treatment room had been soundproofed so that the children outside didn't hear what was going on. That didn't seem to me to be an adequate solution. And I kept coming back to, what if this was happening to one of my children? How would I be feeling? Patient-centred care became my big passion, and it was really the beginning of the Hush Foundation, bringing patients and families in and then making changes based on what they said. One of the other things they talked about was the environment when you come into a hospital. It's very challenging, you're feeling vulnerable and scared, and what if there was some music in that environment to help keep you calm? My children were learning from professional musicians at the time, so I love tapping into whatever expertise is around, and I started to bring composers and musicians into hospital spaces to get them to help us think about how we could improve that environment. And in the beginning, I was thinking, this is calming for the children. We can get them off to sleep more calmly with beautiful music in the background. But guess what? It was also calming the parents, and that made a big difference, because how the parents are feeling obviously reflects on how easy it is to look after their child. And the next benefit turns out that it was really good for the staff. So Hush music now is played in operating theatres, waiting rooms, treatment areas, in hospitals all around the world. And for the general public, it really took off as something that could make a difference for lots of people. In 2010, I was fortunate to travel on a Churchill Fellowship, and that was a turning point for me. That was quite life-changing. I came back from my Churchill absolutely inspired to continue creatively working on transforming the culture in healthcare. And I connected then with Alan Hopgood, an Australian playwright who'd been doing some plays that he put on around his own prostate cancer journey. And those plays were a very effective way to get people talking about healthcare issues. So this has been really inspiring to me, to see the impact of live performance and music in hospital spaces. And we also run the Gathering of Kindness, bringing people together, really like gathering the tribe, so that people who are like-minded can feel that they're connected to something that really resonates with them. And the other program we have is Kindness in Action. This is a 10 to 12-month program where individuals and teams can really delve a little bit deeper into the background behind this kindness work and why it's so important, and how it can be implemented. So a lot of what comes out of the Kindness in Action are best practice ideas that we have gathered. Hush is driving a kindness movement to inspire and to bring together all the voices in healthcare to be able to drive change.
I think the Gathering of Kindness is amazing. You call it the gathering of kindness. It's almost the release of kindness. Call me naive, but I think that most people want to help. Most people want to be kind. Most people want to be gracious and use their skills to help others. The problem is we're trapped in political systems, managerial systems, historical systems that cap that prevent it, that chill it. But when you do what the Gathering of Kindness have done, and you say, "Come on in, let's celebrate our native instincts to help," it just releases this energy in such a wonderful way. Now the challenge is, are there leaders smart enough to use it? So the Gathering of Kindness, although it's still in its adolescence as an international phenomenon, I think needs to take over the planet.